On passe au quatrième sujet, cancer pédiatrique. On en a beaucoup parlé. Olivier Véran a rappelé que c'était une priorité. Ça prolonge la masterclass d'hier de Dominique Carrez. Un taux de survie qui a été considérablement amélioré, mais on le dit, 35 000 nouveaux cas encore par an. Alors, pour voir comment agir plus et plus efficacement dans ce champ, on accueille Gilles VASSAL, président de l'I. Et il est avec nous déjà, sous les applaudissements. Normalement, il y a un jingle qui vient.
Hello.
Bon, bah, on a le jingle tout de même ou non?
No jingle.
Non.
Let's move.
Oh, bah non, Alors, président de l'ITCC, l'Accelerated Platform dont on a parlé, professeur à Gustave Roussy à Villejuif, à côté de Paris, très grand connaisseur de ces sujets. Alors, this is to have a short introduction about this topic. This is a topic where a lot has been done in the last years. We talk about the regulation, there's a lot of research ongoing. It's on the priority for the French national plan, for the European plan. So what are still for you the main difficulties to address in that pediatric field?
So you said 35,000 children and young people are diagnosed each year in Europe with cancer.
Said, yes.
Three numbers. 80% of them will be disease-free, thanks to the treatment established over the 50 years by European and international clinical research, raising the probability of survival from less than 40% to 80%. But 20% difference across Europe, from west to east and east to west. We need to reduce inequalities. Second, very soon, there will be 500,000 European citizens who will be childhood cancer survivors. Already 300,000. They have, for two-thirds of them, consequences of the treatment they receive, which are often very intensive, and consequences of the disease. We really need to cure them better. We need to reduce intensity of treatment and to provide any childhood cancer survivor with a passport, or whatever we call it, smart card European, with a passport that will provide all the prevention, all the measures, all the follow-up that will assure that those of them having two-thirds of the sequelae will be light sequelae. Third number, 6,000 children and young people die each year of cancer. The leading cause of death by disease in this population. And the plateau of the survival over the last 5 to 10 years. We did the most we could. And we need to boost innovation to understand better this disease and develop and accelerates the development of this innovation to increase the survival rate. So in summary, cure more children and young people with cancer, cure them better, tackle inequalities, and above that, understand better cancer. We need to reinforce the research on cancer, especially to understand why a child has a cancer, which is one of the questions that the parents are asking after they ask the question, will my child survive?
One thing that is coming is the fact, yesterday we saw it, that there's a lot of collaboration ongoing. The Accelerate platform is a shame for that. What is needed to support better and to sustain better this collaboration at the European level? A lot is done already, actually.
Absolutely.
You did it yourself.
No, not only.
The community.
Yeah. Oh, just a message. I am just reporting the discussion in the group that was installed by the ANCA with parents, patients, survivors, pediatric oncologists, radiation oncologists, representatives, researchers, representative of the European Medicine Agency and of the French authorities.
That's what I mean. The community organized itself a lot to collaborate.
This is the group. All the work that will be reporting in the group, the work for the group. So, February 2020, President von der Leyen launched the cancer initiative in Europe. And she said, childhood cancer is a priority at the European level, and they will be put under the spotlight. We are in February 2022, 2 years later, and this is it. This morning, Mr. Olivier Véran Commissioner Celia Keratides and MEP Véronique Trier-Lenoir highlighted the fact that it is a priority. And when we look at what has been done, despite the COVID crisis, clearly there are measures really that can help in the next 10 years to cure more, to cure them better, and tackle inequality. So clearly this cooperation is existing. We need now the member states to step in more, to cooperate, because this is something that will be done only at the European level with all stakeholders and with the member states. So this is why we strongly believe that there is an agenda, and this really can deliver on the objective in 2030.
Let's go to the statement for this group, which there were a lot of convictions and a lot of really, as much as I heard, it was really a group where they want, you were very precise on the wording, precise on the statements. You really want to have the one word and the one measure that you want, that were really the consensus for the group. First measure, establish new ways to coordinate and follow the actions specifically related to pediatric cancer, to support the goal-driven, successful and coherent implementation of actions and projects concerning children and young people with cancer. This is something important because it looks like, as much as I could see, that implementation was a main word coming in the discussions. You had a regulation already happening, and it didn't go to all the promises of this regulation. A new one is coming, and you are to be quite vigilant about what's going to come out of all this good news and good promises from the regulation and the new changes. How can you establish new way to coordinate? How can you follow the action and their implementation concretely, actually?
So in the Beating Cancer Plan, there is a flagship program on childhood cancers. But there are actions in the BT Cancer Plan outside the flagship program that concern directly children and young people with cancer. In the cancer mission, there is clearly a say to improve, but outside of this, there are as well other measures. In the pharmaceutical strategy, the revision of the pediatric regulation, the revision of the orphan regulation, directly for childhood cancer, but the implementation of the HTA regulation that we were discussing yesterday with Véronique Trier-Lenoir, and other measures regarding shortages and so on really concern childhood cancer, children and young people with cancer. And there are other measures across Europe. So we say all these measures can really make Europe achieving the goal of getting more and better. And we think that might be a little risk because it's complex. Understanding this on the ground level and even at the upper level is complex. The interaction between the Beating Cancer Plan and the mission is not obvious. And we said that would be really great to have a proposal to coordinate and follow these actions related to pediatric cancer across all these measures that would really facilitate Europe to really achieve the goal as mentioned. So it is not us building this. And we said to the Commission, we said to the Council, we said to the Parliament, let's figure out how this could be done in the next year to assure that all these measures will be implemented in such a way that we will achieve the goal.
Let's use our expertise.
We are ready. We are working together. The cooperation bit and the work together between the professionals and the parents and the advocates and survivors is really, really good in our field. So we are really, really and willing, keen to collaborate and work with the people.
This is a claim for this first statement. Second statement, ensure the right of children and young people to access clinical trials by reinforcing international clinical trial platforms in pediatric oncology, hemato-oncology, and the reference network of pediatric cancer, the IRN, and facilitate access to cross-border clinical trials by lifting actual current administrative, legal, and financial limitations. Let's start with the second point, the cross-border clinical trials facilitations. What might be the lifting? What is important in that lifting to facilitate the cross-border?
But why did this pop up as a priority? In pediatric oncology, clinical research and care are integrated on a daily basis. We are not talking only on the development of new medicine with pharmaceutical companies under the pediatric regulation and the better regulation that will come up. We are talking about the clinical research set up by the academy over the last years on therapeutic strategy, really providing not only a way to continue to increase the probability of survival, but also to provide quality of care. And it's clear that frontline treatments in clinical trials really help increasing the quality of delivery of care for these patients. So you need to know that more than 60%, sometimes 70% of patients at diagnosis participate in Europe to academic clinical trials. But this is again an inequalities across Europe. Because in other countries, especially in Central Europe, this is less than 20%. This is why it is important that this should be reinforced to provide access to all children in Europe to those clinical trials. It's not only developing new medicine, it's really developing better strategy and improving care.
Meaning that they have to be accessing this clinical trial by traveling to countries where
Not
they
necessarily.
are or in their own country?
And we need both. Reinforcing at the national level how to improve the infrastructure to deliver such clinical trial, and when it is needed, because sometimes it is needed, facilitate cross-border delivery of clinical trial in another country. But let me say a message on this. This is a message to the member states. In the Joint Action on Rare Cancer, Joseph Borras did an evaluation of all national cancer plans, and we looked at the pediatric topic in this cancer plan. 50% of this plan did not address pediatric cancer, and only one cancer plan was addressing comprehensive plan for, no, not center, a comprehensive cancer plan for childhood cancer. So our aim, our wish is to see each national cancer plan among the 27 member states implementing a childhood cancer plan connected to the European plan that will assure that all what is set up at the European level can really be delivered at the national level. So that would be a plea to member states. Please install in your cancer plan a childhood cancer specific plan.
Strategy. Okay, this is known also, that will be in the statement. And the third statement, very important, is the one on data sharing, like for prognosis cancer, reinforcing the benefits of research and long-term following up of patients by principle to be applied and harmonizing the application of the regulation. Why is it so important to have a focus on this data sharing and how to promote them better on these pediatric cancers?
So why? Cancer in children is rare. Cancer in children is sometimes ultra rare. We have more than 60 different malignancies. The only way to progress is to get together. This is what we have been doing over the last 50 years. And nowadays, we need to share data. We need to be able to reuse data. And not only data, but biological samples. And this is absolutely crucial, because if you want to run artificial intelligence, no, artificial intelligence or artificial intelligence.
Artificial intelligence.
You need large numbers. And if you have a rare constituent, you need to aggregate at the European level and at the international level. So this is why we say that in our field, it's absolutely crucial. And we have been doing that already. Just to say that in 2014, the International Cooperative Group on Neuroblastoma decided to build together an initiative called INRG, International Neuroblastoma Research Group, just to pull together clinical data and molecular data. At that time, this is 20,000 data from 20,000 children with neuroblastoma, which is available. Neuroblastoma, young people, 7% of cancer, and so on. So this is feasible. And what we say, GDPR is slowing down the process. GDPR at the moment, because the harmonization is not there, because the implementation in the different member states and in the different institutions in the same member state is interpreted differently, really makes life difficult, not only for childhood cancer researchers, but all researchers. So we say, let's make the general data protection regulation friendly for research. Not modifying the research, the regulation, but making this really facilitating sharing, facilitating reuse of data, facilitating data linkage, and facilitating the cooperation with international groups. And this is one of the actions that we would like to see, making GDPR friendly for research, for example, for childhood cancer research.
Last question, the next step for you, what would it be through all these statements?
So yesterday we discussed a lot what would be the next step. That was a good debate. And we come up with, first, we would like to see a roadmap that would take these actions and say how we will implement, who will be doing what, just to transform this nice work and commitment. And we see that the Commission, that the trio and so on will endorse some of these actions, how this would be implementing in the next years. And the second action we would like to see, and is clearly how the coordination and the follow-up of all these actions for children across all members, all initiatives in Europe on cancer would be really set up.
Okay, these are the next steps, and this were very discussed, as you discussed everything very...
And finally, yes, cooperation with the member states. That is very important for the EAR and PEDCAN. EAR and PEDCAN is an instrument which is very important, but we need support by the member states. We need the member state to say at the national level, childhood cancer is a priority. And this is how would be, what will be implemented at the member state level. Cooperation, working together. And we showed that in the field of pediatric cancer. Professionals and patient, parent, supervisors are really working together, and we are keen. You mentioned accelerate. Well, we work with EMA, FDA, industry, and we move the lines.
Like Dominic,
so let's move the lines together.
Like Dominic says. Thanks you for your convictions. Thank you for the proposal. Thanks a lot, Gilles. We can applaud him and applaud all this proposal from the group.